My name is Magaly Rodriguez de Bittner. I'm a professor at the University of Maryland School of Pharmacy here in the United States, but I am also a pharmacist. And my practice is in ambulatory care clinics within many of our healthcare system. Today, I'm going to be addressing the role of the pharmacist in treating minor ailments and really highlighting what an important role we have in terms of triaging patients, evaluating patients, and making sure that we do appropriate referrals. Pharmacists can play a very, very important role in supporting the identification and referral of patients who have minor ailments but might need some evaluation from other healthcare providers. Pharmacists are key players in the healthcare system since they are accessible. And in many of our countries, patients see pharmacists as these sources of reliable information, and pharmacies are accessible places where patients do go to ask for advice and to ask for the treatment of many of these minor ailments using some over-the-counter prescription medications. In particularly, I think that pharmacists have a very, very important role in following a process to ask appropriate questions and using a system to identify what are the symptoms the patients are having, what are the acuity of those symptoms and severity, and being able to also, using the information that we have available in our pharmacies, identify what are those drug therapy that the patients may be receiving, what are the medications that they're receiving, and being able to assess if many of these minor ailments could be caused by some of the medications the patients are taking. So as such, our role is critical. It's critical not only in asking the appropriate questions, in identifying the appropriate symptoms, but also in making sure that we create a complete picture of what is going on with the patient by assessing what are the drug therapies that they're using, or what prior over-the-counter medications or what prior attempts they have had to relieve the symptoms that are in question. So pharmacists, again, could play a very, very important role in identifying if a patient does need further referrals, particularly referrals to a healthcare system, referral to an emergency room, if those symptoms are acute enough, or during the interview you identify that the patient is having a very, very severe symptom that needs an acute intervention, or by making sure that the patient does follow up with an appropriate primary care provider. So in summary, pharmacists play a very, very important role in assessing, evaluating, and triaging patients to further workup or for further care, depending on the symptoms and the severity of the symptoms that they present while they come to our pharmacies. How can pharmacists develop a relationship with patients and get patients to develop a high level of trust and respect? I do believe that in the area of self-care is an area in which pharmacists have a tremendous role in assuring that patients see us as a reliable source of information. It's very important that the patients rely on us, healthcare providers within the community, to be able to answer questions, to be able to provide appropriate guidance, particularly when they're selecting an over-the-counter product. This can also be achieved by engaging our pharmacists in campaigns, by engaging our pharmacists in developing educational programs that are delivered from the pharmacy that address many of the common ailments that we see and that patients experience, and that might have treatments that could be over the counters. Examples of those are creating a campaign during the summer months that address the issue of using sunscreens, the issue of protecting themselves and skin care, and being able to educate our patients to evaluate what are some of the lesions and what are some of those findings that they can see when they do self-examination of the skin that does require further follow-up. The same thing happens during the winter months, where again, the propensity of individuals to develop colds, to develop the flu is much, much higher. So again, creating educational campaigns and displays within our pharmacies to be able to educate the patients in how to properly assess their symptoms and when should they seek treatment, when it's appropriate to use over the counter, but when it's also appropriate for them to seek further medical or healthcare services. So by engaging in this type of educational interventions within our pharmacies, by partnering with many of the national campaigns that sometimes happens in our countries, that is a good way for the pharmacists to increase the perception of the patient that we are here for them, the perception of the patient that we're healthcare providers that are accessible, and that we are a reliable source of information. This does increase our potential to develop these relationships and partnerships with the patients and creating a culture where the patients see us as this reliable healthcare provider and be able to then develop this trusting relationship. Pharmacies have a very, very important role, as we saw it during the COVID-19 crisis, to serve as a center, to serve as a place where individuals can go to receive diagnostic tests and where they actually can go to receive diagnostic services to offer and enhance their treatment of so many self-care conditions. For example, I wanted to use the example of a service that we offer here in the United States. That service relates to individuals that may have a strep throat. In the United States, there are some pharmacies that are able, under the law and under the scope of practice of pharmacists, to actually perform diagnostic tests within the pharmacy for strep throat. By doing so, patients come into a pharmacy. The pharmacist will conduct an interview of the patients. Usually is a very structured set of questions that we ask. And once those interviews take place, the pharmacist can actually perform the diagnostic test right in the pharmacy and be able to assess if that individual, in fact, is positive for the strep throat. In addition to that, many of our laws also allow in some states for pharmacists to be able to initiate treatment. So pharmacists may be able to actually start treatment for the strep throat condition and actually be able to provide the patients with the medications that are needed to treat their minor ailment. By doing so, one of the critical steps that are very, very important for us to keep in mind is making sure that that process, making sure that that diagnosis and treatment gets documented and that information is forwarded to the patient's primary care provider with the aim of making sure that there's an integration of the patient information within the patient's record. So what we do is electronically, we're able to send not only a copy of the test, but also a note where we clearly explain what was the symptoms presented by the patient, what was the assessment conducted by the pharmacist, what is the test that was performed, the results, and what is the treatment plan and the particular medications that that patient was actually provided. Another example where pharmacists can conduct some diagnostic tests within pharmacists is the case of the COVID-19. For different infectious diseases, but particularly during the pandemics, pharmacies can be a critical center and a critical point within the community to really help manage many of these pandemics. In the United States, that was a very important role that pharmacists played during the pandemic. We were able, by federal legislation, to actually conduct tests for COVID-19 in our pharmacies, and also by a federal mandate, pharmacists were able to initiate treatment for these patients. It was the first time where pharmacists were allowed to prescribe many of these regimens without a prescription for a physician. So we were able to demonstrate during this crisis how critical the role of the pharmacist was in public health and making sure that we provide these services to patients within the pharmacies by providing, again, this diagnostic test where we could do what is called test and treat. We're able to test the patients, and we're also able to initiate treatment according to our standard of practice. Pharmacists can also play a very, very important role in helping and stimulating their colleagues to continue to educate themselves, to continue to engage in learning more about the role of the pharmacist in the treatment of these common minor ailments. It is important as these over-the-counter medications continue to evolve. These medications that we call medications, that do not require a prescription, providing opportunities not only to educate our patients, but also opportunities for us to create collaboration among our pharmacies, create collaboration among ourselves as healthcare providers, and really continue to engage not only in learning about the treatment of these conditions, but also by working in collaborating with each other, in creating a variety of services, creating a variety of programs that could really serve not only a particular location, but also regionally and also statewide. In that example, we have seen particularly in my experience and here in the United States, how, again, a group of pharmacists have really worked together to develop, for example, pilot programs where they actually are serving and providing not only diagnostic testing, but also educational services for patients with chronic diseases. An example of that is with diabetes. diabetes being a very common condition that happens, chronic illness that happens in many of our countries, we have a cohort of pharmacists that have really bound together to develop educational programs that are happening from the pharmacies, particularly in community pharmacies. So what we see is that pharmacists are engaging in providing self-care education for patients with diabetes. That self-care education really encompassing all the things that patients should be doing to take care of their illness or to their diabetes. For example, many of the pharmacists have engaged and developed educational programs where patients have been taught how to do self-examination or a food self-examination. And so patients are taught not only to look for signs and symptoms of an ulcer, signs and symptoms of changes in temperature, signs and symptoms that could indicate the development of neuropathy, but we're also teaching them how to use monofilaments and how to actually test themselves for sensation and keep records that they can share with the healthcare provider. So pharmacists can together commit to working as a unit, commit within a location, commit within a regional area, and make sure that they create, develop, and they launch educational programs within the pharmacy to help patients to learn self-monitoring and self-management of many of their chronic conditions, to identify those areas and identify when it's needed for them to seek treatment. So again, pharmacists working together could really encourage each other and elevate the practice of pharmacy within the region.